As we reported here last night, a federal judge in Florida yesterday decided to strike down the CDC's mask rule for airline travel, train travel, and public transportation. It was a little bit of a strange decision by that judge. She made the decision even without hearing arguments in the case. She said she didn't need to hear the arguments. She just ruled on her own. And she said her ruling would apply nationwide, even though the plaintiffs only brought suit in her single district in Florida. Nevertheless, that immediate change ordered by that one judge to this nationwide public health rule has immediate consequences. If you, for example, flew out somewhere for spring break before yesterday's shock ruling, you're going to find yourself flying home from spring break under very different public health rules than you might have been counting on. And maybe that doesn't matter to you. Maybe you didn't feel strongly about it. Maybe you weren't factoring that into your sort of COVID safety matrix when you were planning this travel. But maybe it does matter to you. Maybe it was a big factor. The context in which this happened, not just its suddenness, that matters here too. The CDC had just decided last week that they were going to extend the mask rule until May 3rd. It's a short extension. They just wanted to give the agency a few more weeks to assess what the current uptick in COVID cases might mean for our healthcare system, for hospitalizations, for deaths. They needed a little more time to assess how much the mask rule might help avert the worst of those consequences. And so, again, they plan to extend it just until May 3rd. May 3rd is right around the corner. Now that this judge has thrown out the ruling, effective immediately nationwide, well, that timing has to factor into the government's decision as to whether or not to appeal, right? By the time they've brought the appeal, May 3rd probably will have come and gone, which means the extension that the judge ruled against would effectively be moot. Given the timing here, it has been an open question and an interesting one as to whether the Justice Department would try an appeal. Well, today the Justice Department gave an answer to that question. Quote, the department continues to believe that the order requiring masking in the transportation sector is a valid exercise of the authority Congress has given CDC to protect the public health. That's an important authority the department will continue to work to preserve. If CDC concludes that a mandatory order remains necessary for the public's health after that assessment, the Department of Justice will appeal the district court's decision. So the DOJ is trying to reinforce that the CDC has the authority to set rules for public health. They're trying to give CDC room to continue assessing whether a mask rule is needed, whether it's still a necessary public health measure. But when it comes to the bigger, potentially existential question of whether the CDC has the authority to put public health rules in place in the middle of a pandemic, is that question still open as long as this judge's ruling goes unchallenged? And what does that mean for doctors and nurses treating patients as the number of COVID cases starts to tick back up again? Joining us now is Dr. Craig Spencer. He's the Director of Global Health and Emergency Medicine at Columbia University Irving Medical Center. He's also he is an emergency room doctor practicing in New York City. He's also a doctor with personal experience with scary, contagious diseases. He was the first person in New York City to be diagnosed with Ebola back in 2014 after he returned from treating Ebola patients in Africa. When the COVID pandemic in New York City hit in March 2020, Dr. Spencer was on the front lines treating patients at the very worst of that time. Dr. Spencer, it's a real pleasure to have you back on the show. Thanks for making time to be here with us tonight.
Thank you for having me back on. It's a pleasure.
So it seems to me that there's two things to think about in terms of this judge's ruling. One is just the practical question. People may be watching you right now with your experience as a specialist in this field, as a practicing physician in New York. Is it a good idea to wear a mask on the train, on the subway, on an airplane, even if I'm no longer required? But also, what's your view on this challenge to the CDC's authority to put a rule like this in place at all?
Both those are incredibly important questions. And I will add that not only as a provider, but as a parent of a 3-year-old and a 1-year-old who 3 days ago took a flight to visit family and has to fly back home to New York City in a few days under these new rules, it does give me some trepidation. My 3-year-old and 1-year-old, one can wear a mask, but they're both unvaccinated. The 1-year-old can't. And so it does give me some pause and some worry. I would have preferred that they were on a flight where people were masked. But we're going to have to adapt, and we're going to have to think about how to keep ourselves safe. But my most recent flights before that was with my family to go down and visit immunocompromised family members in Florida. And so I'm just worried that there's going to be a lot of people in similar situations that will be exposed and may expose others. For myself personally, I'm young, I'm healthy, I've been triple vaccinated. My personal risk isn't high, but the risk to others that I might infect or to my kids may be. And that's for the personal and for the family risk. Now, for the more important, I think, legal precedent, what you saw here was not a public health decision. You had a legal decision that overrode the decisions of a public health authority in the middle of a pandemic. And I'm not just worried about what that means right now, today, for flights in the next few days and for the uptick in cases. I'm worried about what that means for the future when we respond to pandemics, when we have further pathogens that threaten us here in the US. We've already had dozens of states implement measures to limit public health authority. Now you have a single judge in one state who has overrode a decision by the central public health decision-making authority. And I think that sets a bad precedent, and I'm glad to see the administration challenging that.
And the administration says they will challenge it provided that the CDC assesses in scientific terms that a continued mask mandate, that a continued mask rule for public transit actually is in the public health interest. And so they're effectively, the Justice Department is effectively saying that they're going to follow the science, that if the CDC still thinks this type of rule should be in effect, then they will appeal the ruling in order to try to reassert the CDC's authority to make those decisions. It still does feel a little precarious in terms of the standing of the CDC to pass these rules in the future. I mean, I understand why the DOJ is deferring to them, but that precedential issue you're talking about is real here.
Absolutely. And also, quite frankly, it's a very confusing point in the pandemic for many people. If you are young and you've been vaccinated, you may think that your personal risk is low. And you may say, well, we know that masks work and we know that having them in congregate settings work. What is even the decision that needs to be made here? What is the CDC even looking at? We know that right now, BA2, that subvariant, is spreading. We've seen it in New York, and we know that it's causing an uptick in cases nationally. We need to better understand what that means, not only for local outbreaks, for bigger outbreaks. In places like New York City, and in other big cities where they've seen a lot of virus and a lot of vaccination, it hasn't led to a dramatic uptick in hospitalizations, thankfully. I don't see a lot of COVID patients in the ER right now. We're not admitting a lot, but that's not going to be true for every place in the country. So these decisions might seem really difficult and hard to kind of untangle even 2 years in. But the fact is that we are one country with many different subpopulations of vaccination, exposure, immunocompromised states, et cetera. That's what makes it so difficult. And that's also why it's so important that people have a bit of empathy, even if the pandemic is over for you. It's not for a lot of people, including parents with kids and people who are still immunocompromised and might not have access to the type of care or the medications that they need to stay safe, as everybody else has.
Dr. Craig Spencer, Director of Global Health and Emergency Medicine at Columbia University Irving Medical Center. Dr. Spencer, it's a pleasure to have you here. I am sorry that you guys got stuck. You got stuck in the middle of your round trip with the rules changing in the middle of it, but I hope you enjoy your time away and good luck.
Thank you, Rachel.